Most of us have felt that burning sensation after a big meal or spicy food, heartburn. It's that uncomfortable feeling that can creep up after enjoying a particularly rich or spicy dish. Sometimes it's a mild annoyance, other times it can feel like a fire is raging in your chest. For many, it's just an occasional annoyance, easily fixed with an antacid. A quick trip to the medicine cabinet, a chewable tablet, or a swig of liquid relief, and the discomfort fades away. We might not even think twice about it. But what if it happens several times a week? What if that burning sensation becomes a regular visitor, disrupting your meals and your peace of mind? That's not just heartburn, it's acid reflux, and it affects millions. It's a common condition, but that doesn't mean it should be ignored. It can impact your daily life and, more importantly, your long-term health. Acid reflux happens when stomach acid flows backward into your esophagus, the tube that carries food from your mouth to your stomach, irritating its delicate lining. The esophagus isn't designed to withstand the harsh acidity of stomach fluids. Imagine spilling a harsh chemical on fabric. One spill is fine, you might be able to clean it up without lasting damage. But repeated spills cause damage. The fabric weakens, discolors, and eventually deteriorates. Chronic acid reflux can do the same to your esophagus. Over time, the repeated exposure to stomach acid can lead to inflammation and other complications. In the UK, up to 1 in 4 adults regularly experience heartburn. That's a significant portion of the population dealing with this uncomfortable condition. We often normalize it, blaming stress or food, attributing it to a busy lifestyle or a particularly indulgent meal. But persistent heartburn is a warning sign. It's your body's way of telling you that something isn't quite right. If it occurs 2 or more times a week for weeks or months, if you find yourself constantly reaching for antacids, it's called gastroesophageal reflux disease, or GORD, also known as GERD. GORD means the valve between your stomach and esophagus isn't working properly. That critical barrier is weakened or damaged, allowing acid to cause ongoing irritation. This constant exposure can lead to more than just discomfort. This can lead to serious changes in the cells lining your esophagus. These changes, while microscopic, can have significant consequences. The damage is silent. You only feel the burn, not the deeper harm. It's a sneaky condition, masking potentially serious issues with a common symptom. Chronic heartburn isn't just a nuisance. It's a signal your body needs attention. It's a red flag that shouldn't be ignored. Ignoring it could mean missing the early signs of something much more serious. Early detection is key to preventing long-term complications. It's time to take persistent heartburn seriously. Don't dismiss it as just a minor inconvenience. It's a call to action for your health. Persistent heartburn is your body's alarm system, signaling that something isn't quite right. It's a persistent discomfort that shouldn't be ignored, especially if it occurs frequently. Think of it as a red flag, waving to get your attention. Ongoing acid exposure, day after day, week after week, can lead to a condition called Barrett's esophagus. This is where the cells lining your esophagus begin to change due to the constant irritation from stomach acid. It's a precancerous condition, meaning it's not cancer yet, but it has the potential to develop into cancer over time. In Barrett's esophagus, the esophageal cells undergo a transformation, changing their structure to better protect themselves against the damaging effects of stomach acid. It's important to understand that Barrett's itself isn't cancer. However, it significantly raises your risk of developing esophageal cancer compared to someone without the condition. The risk isn't enormous, but it's definitely elevated. So what's the problem? Why is this so concerning? The insidious thing about Barrett's is that it often has no symptoms beyond the heartburn you're already experiencing. It's a silent progression. Many people are completely unaware that these cellular changes are happening within their esophagus. They continue their daily lives, oblivious to the potential danger lurking within. The journey from persistent heartburn to Barrett's esophagus and, potentially, to cancer is a slow and gradual one. This progression can take years, sometimes even decades, to unfold. It's a marathon, not a sprint. This slow progression gives us a crucial window of opportunity to intervene and prevent cancer from developing. But we can only seize this opportunity if we recognize the risk associated with persistent heartburn and take it seriously. Early detection through screening and regular checkups means we can closely monitor the condition. We can also treat any abnormal cells that are detected, effectively preventing cancer from ever developing. Unfortunately, the reality is that most people don't seek medical help for their heartburn. They often delay seeking help until the condition has progressed to a more advanced stage, when treatment options may be limited. We must change our perception of heartburn and stop thinking of it as just a minor inconvenience or simple indigestion. For some individuals, persistent heartburn may be the only warning sign, the sole indicator of a potentially precancerous condition developing in their esophagus. The longer the acid reflux continues, unabated and untreated, the greater the risk of developing Barrett's esophagus and subsequently esophageal cancer. It's crucial to treat persistent heartburn not as a mere inconvenience, but as a legitimate medical symptom that warrants investigation. Don't dismiss it as just something you have to live with. If you experience ongoing heartburn symptoms, it's essential to talk to a healthcare professional and discuss your concerns. Esophageal cancer is a silent, deadly disease. The type most linked to long-term heartburn is adenocarcinoma, which develops where acid does the most damage. Early stages rarely cause symptoms, making it hard to catch. When symptoms do appear, like difficulty swallowing, unexplained weight loss, or persistent heartburn, it's often advanced. Many symptoms mimic less serious issues, so they're easy to overlook. Late detection is why survival rates are so low. Early diagnosis means better outcomes, but most cases are found late. We need to find high-risk people before cancer develops. That means identifying those with chronic heartburn and Barrett's esophagus. Many are unaware they're at risk. By offering a simple, accessible test, we can catch problems early. Early detection can turn the tide on esophageal cancer. Prevention starts with awareness and action. The NHS in England is piloting a new program to catch esophageal cancer early. Now, people with persistent heartburn can get checked at their local pharmacy. This brings life-saving screening out of hospitals and into the community. The pilot targets those on long-term heartburn medications 6 months or more. Eligible patients are invited by their GP to book a pharmacy appointment. Pharmacists, trusted and accessible, make screening less daunting. The goal: find Barrett's esophagus before it turns into cancer. If Barrett's is found, patients get regular monitoring or treatment to remove abnormal cells. This approach is a game-changer, catching problems early, close to home. Traditional checks required hospital endoscopy, which many avoid. The new test is quicker and gentler, and done in minutes. Early detection in the community could save thousands of lives. The heart of this innovative program lies in its simplicity and effectiveness. It's designed to be a game-changer in early detection. At the core of this screening process is the cytosponge, a marvel of medical engineering. This ingenious device is affectionately nicknamed the sponge on a string, a testament to its straightforward yet impactful design. It's essentially a small, easily ingestible capsule attached to a thin thread, making it incredibly easy to administer. The patient simply swallows the capsule with a sip of water, much like taking any other pill. Once it reaches the stomach, the capsule's outer layer dissolves, preparing it for the next stage of the process. This releases a tightly compressed, tiny sponge, ready to perform its crucial task. The sponge then gently expands within the stomach, transforming into a small, soft sampling device. After a short period, the healthcare professional gently pulls the string, retrieving the sponge. As it's pulled back up, the sponge delicately collects cells from the lining of the esophagus, gathering vital information. The entire process is designed to be quick, efficient, and most importantly, as comfortable as possible for the patient. Once retrieved, the collected cells are carefully sent to a specialized laboratory for analysis. In the lab, highly trained scientists meticulously examine the cells, looking for any telltale signs of Barrett's esophagus or other abnormalities. If the scientists detect any abnormal cells during their examination, it triggers the next step in the process. In such cases, the patient is then referred for a more detailed examination using an endoscopy to confirm the findings. It's important to understand that the cytosponge is not intended to be a complete replacement for a traditional endoscopy. Instead, the cytosponge serves as a brilliant and highly effective triage tool within the broader diagnostic process. Its primary function is to accurately identify those individuals who are most likely to benefit from further, more invasive testing. By doing so, it effectively spares the majority of patients from having to undergo unnecessary and potentially uncomfortable invasive procedures. Remarkably, the entire appointment from start to finish typically takes less than 15 minutes of the patient's time. This makes it a simple yet incredibly effective way to catch potential problems in their earliest, most treatable stages. For many individuals, the cytosponge offers something invaluable: peace of mind. knowing they've taken proactive steps for their health. And all of this can be achieved without the need for a potentially stressful and time-consuming hospital visit. In the realm of healthcare, early and easy testing like this can truly make all the difference in achieving positive health outcomes. David's story shows the power of early detection. After decades of heartburn, he managed symptoms with medication, never suspecting a bigger problem. When invited to try the Cytosponge, he agreed, seeing it as a routine check. The test was quick and painless. Weeks later, he learned he had Barrett's esophagus and a tiny early-stage cancer. Without the test, it would have gone unnoticed until it was too late. Because it was caught early, treatment was simple and successful. David avoided major surgery and chemotherapy. Today, he's cancer-free and monitored regularly. His story could have ended in tragedy, but a 10-minute test changed everything. Early detection turned a silent threat into a treatable condition. David's experience is a powerful reminder. Don't ignore persistent heartburn. Screening can save lives. Sometimes it's that simple. If you're eligible, take the test. It could be the most important decision you make. Traditionally, checking the esophagus meant a hospital endoscopy, a camera down the throat, often with sedation. It's effective but invasive, uncomfortable, and resource-intensive. Many people avoid it, especially if their symptoms seem minor. The Cytosponge changes the game. No sedation, no hospital, just a quick test at your local pharmacy. It's far more accessible and less intimidating. The Cytosponge isn't meant to replace endoscopy, but to act as a filter. It identifies those who truly need further investigation. Most people with heartburn have a normal esophagus. The Cytosponge helps avoid unnecessary hospital procedures. It frees up resources for those at highest risk. The result? A more efficient, patient-friendly pathway to diagnosis. Early, easy screening means more lives saved. Esophageal cancer is the 14th most common cancer in the UK, but its death rate is high. Each year, over 9,000 people are diagnosed, and nearly 8,000 die from it. It's the 7th leading cause of cancer death in the country. The gap between diagnosis and death is small. Late detection is the main reason. Early-stage diagnosis means over 80% survive at least a year, but most are diagnosed late when survival drops below 25%. Only 17% survive 5 years or more. Rates are rising, especially in men, and risk increases with age, obesity, and smoking. Chronic heartburn plus these factors raises your risk even more. These numbers show why targeted screening is critical. Early detection can shift survival rates dramatically. The Cytosponge could help turn a deadly cancer into a preventable one. The opportunity for change is now. Protecting your health starts with you. If you have heartburn 2 or more times a week for 3 weeks or longer, don't ignore it. Persistent heartburn deserves a conversation with your GP or pharmacist. Don't just rely on antacids, get checked. Watch for red flags: difficulty swallowing, unexplained weight loss, hoarse voice, persistent cough, or vomiting. These symptoms may have other causes, but it's vital to rule out something serious. Early diagnosis saves lives. The Cytosponge and NHS Pilot make early detection easier than ever. If you've had chronic heartburn for years, ask about the new test. Being proactive isn't alarmist, it's smart. This initiative empowers you and your healthcare team. Don't dismiss regular heartburn.